name is Mahesh Narayanan. I'm the program director for Series A at Newchip. Thank you for joining us at Online Demo Week. We have an amazing roundtable panel for you guys around startups and COVID. Today we have Dr. Saraswathi Muppana. She's an internal medicine, pulmonary, and sleep medicine specialist treating multiple patients with COVID in various stages since the beginning of the pandemic. She's affiliated with medical facilities such as Beth Israel Deaconess Hospital in Massachusetts. Thank you, Dr. Muppana, for joining us.
Thank you.
We also have Gena Lindsay-Bourne. She's a principal at Journey Ventures Partners and has advised over 100 early stage companies on product, finance, and valuation. She holds an MBA and a master's in applied economics. Thank you, Gena, for joining us as well. So I just want to give a few minutes, Dr. Muppana, to expand on your introduction and talk about some of the things that show your experience in COVID, as well as some of the things you want to share with us. So please go ahead.
Sure. Thank you. Thank you so much, Mahesh, for inviting me. And thank you, Gena, for being on this panel as well. So as Mahesh introduced me, I do pulmonary critical care and sleep medicine, and I'm affiliated here at Beth Israel in Boston and also Tufts Medical Center in Boston. Because COVID started off initially as a pulmonary disease, I've been very much involved in taking care of COVID patients, even when we didn't even know what it was. As we know now, it's been 1.5 years since we've been battling with the COVID pandemic. And I think we're in a much better place now compared to last year, or last January or February, I should say. We've learned a lot, exchanged a lot of information across the globe. And in the process, I feel it helped many people. But unfortunately, we did lose so many people as well, physicians, healthcare workers, and everybody. I'm sure like everybody knows somebody whom they've lost or been affected with this COVID and this whole pandemic. And the pandemic taught us a lot of lessons, how to be more humble and how to live minimalistically. I think those are the two main lessons that I've learned, and feel blessed to be alive and be healthy. And thank you again, Mahesh.
Absolutely, yeah. I think COVID's definitely been a huge lesson and a humble lesson for all of us. Thinking that we could just do whatever we want, and then suddenly something we can't even see is affecting our lives. So it's definitely been a humbling experience, and yeah, it's definitely unfortunate how many people have lost their lives due to this. Right. But I think certainly we've done a lot better, where we haven't lost even more than at this point, and have kind of reined in a little bit, at least on the death toll, if not on the COVID numbers themselves. And Gena, anything you'd like to add as well?
Well, I'm just so appreciative about the context of how our lives have been transformed from the first sort of humbleness and maybe a little bit of minimalist experience, but also I would say just the priority around family. The first year of the pandemic, I was, both of my parents are at an age where any potential impact that my behavior had on them had to be mitigated for their safety. And never have I had my family more top of mind. And the impact of that was bittersweet because I couldn't see them, but I was also really grateful that my attention had to be focused on them. And so I just appreciate that you brought that up, Doctor, because aside from the humbleness, it was just keeping a laser focus on family safety.
Absolutely. Absolutely. Yeah.
Perfect. So I just want to start off with a few questions that I had for both of you. So I'll jump between each of you between the questions, but certainly I wanted to be more of a discussion than just a question and answer session. So the first question I have for you is Dr. Muppana. As the U.S. is plans to have these booster shots, some suggesting 6, some suggesting 8. You're still waiting to hear on the final months of what you have to wait for to get another booster, and this is expected to be coming in the next couple of weeks or so from the federal government. So what are you seeing from the patients when it comes to taking the vaccines, getting boosters? What have been their thoughts? Are they willing to do that? Are they not so keen on taking another booster? What are some things that you're hearing from patients, and what are you seeing as a clinician as well?
Sure. Thank you. I think this is an excellent question. Every day I run a pulmonary clinic and I also see patients in the hospital. And every single day we get so many calls from our patients saying, okay, booster is available. Should I get it now or should I wait? And most of my patients, because it's a pulmonary clinic, few of them are also asthma, COPDers, and even primary care patients. So it's a good mix what we have. And they call and ask, when should I get my flu? Should I space it between my booster and my flu? And should I get my booster at all? Is it really worth it or not worth it, given the fear of risk of complications from the vaccine, what they've heard and seen? So my take is, yes, they should get the booster. And two, I always tell them space the flu and the flu vaccine and the booster dose, because you don't know which, if they take it next day, consecutive days or 2-3 days apart, you don't know which one gave you the reaction, if at all you develop a reaction. So I tell them, take your flu shot or booster, whichever is available first, take it and space yourself, give yourself 2 weeks at least time. So you know what happened in those 2 weeks, it'll announce itself in case you're developing a complication or a reaction. You would know, like a skin rash. Few of my patients did have skin rashes when they got their first and second doses. And you would know, it'll announce itself, right? If you have a complication by then. Then after 2 weeks, you take the other one, vaccine, whichever it be, flu or booster. Immunocompromised patients, those who have diabetes, those who are immunocompromised on cancer therapy, they've already received their booster shots. They've already started to receive the booster shots. And I live in Massachusetts, and we're very proud of our Governor Baker, done an excellent job, and the vaccination rate is really high, and we are proud of it. And they're all interested in the booster. However, there is a small percentage of patients who are afraid to take the vaccine because they've seen it in their immediate circle, some complications that the person must have developed after the vaccination. So that's a very, very tiny percentage, but most of them have got vaccinated in Massachusetts, I'd say, majority of them. They got the 2 doses. Regarding the 6 months to 8 months, I really feel we don't have much data on that. Yes, 8 months is what was announced initially, but I think given its fall time and given its flu time and maybe the COVID time too, I feel it's right time to get the booster now, September, October, and till Jan. So that's my take. Let it be 6 weeks or 6 months or 8 months. I feel 6 months, it's better now because of the fall season. And that's one thing. And the second part is actually, they should definitely get the flu vaccine. It should not be undermined at all. We did very, very well with the flu last year because everybody was hand sanitizing and they were actually maintaining distance and they were wearing a mask. So my flu, usually I see a lot of flu during this fall months and winter months. But last year, I think I just saw only a handful of flus. We were testing for COVID mainly, and we were testing for flu if the COVID was negative. Only then we were testing for the flu. But the flu was way down. So that, I think that's a good part with the precautions, CDC precautions that we are following for COVID as well. It seems to hold good for flu too.
I just have a quick question, Dr. Muppana. I'm wondering, when you're going over the difference between reactions for the flu shot versus the booster and how to keep that in mind, from the lens of a business owner who may come to you, to your clinic, or from the lens of a business owner that maybe wants some feedback or tips on how to communicate this, what are some strategies that you would encourage them to use when they're trying to set a tone for their employees and their business?
So if they have a small business and if they're physically seeing people, they open the doors to for the patients or for the clients or customers or anybody coming into their restaurants or whoever it is, small business, right? And they have, if any patient, they have to have signs there saying anybody has cough, sneezing, or any respiratory symptoms, or if you think you could be having COVID, please do not enter. Okay, it might turn people off, but I think it's the right thing to do. That's one thing. And two, they should also have hand sanitizers available and masks also available right there within the reach as people are coming into your small business. I think they should just be able to keep it very handy so they can use them. Massachusetts made it a mandate for, if I'm not vaccinated, I cannot go to the hospital to see patients. My hospital system has made it mandatory. So if you're not vaccinated, you're not allowed to go into the hospital, which is, I think, any healthcare worker should. I feel it's the right thing to do, but there are some healthcare workers who cannot take the vaccine because of anaphylactic reaction or any of those serious complications. That's a case-by-case basis, just like for flu, right? All healthcare workers should take the flu unless there's some compelling reason they can't take it. So it has become a mandate for us to take the vaccine for COVID. Now, coming back to your point, I think the signs should be there, and maintaining safe distance, those signs also should be there. They should continue to be there. And also giving them the tools like the sanitizers, as I mentioned, and keeping the bathrooms clean and just spacing them out within their seating areas. So the basic things, I think those all should continue to be in place. And given that we're going into fall and winter, we won't be able to sit outdoors anymore, at least in the northeastern part. And that's going to be problematic. So if they have any, like they have a gym or a restaurant, or any places or a hair salons, I think what they should do is, or even offices, small offices with cubicles and everything, they should be having methods to see how the ventilation is, making sure there's good ventilation, maybe cracking open a little small window during daytime just for the air to pass and cross ventilation. So being a little more mindful about those small things, but it makes a lot of difference.
And Gena, kind of following up on what Dr. Muppana said in terms of mandates, some states have had these mandates in place. The Biden administration just 2 days ago announced new measures to include a huge vaccine mandate for all federal workers, any contractors, and they're also requiring any large companies that have not yet mandated. A lot of the big ones already have, Facebook, Amazon, all of them already have said there's some type of mandate in place, and they are requiring these large companies to have mandates as well, or at least regular testing for employees. So in your perspective, Gena, how are startups handling this particular situation, or can they handle the situation? Because large companies have a lot more resources, they have a lot more ways to mitigate these type of risks than small companies who are, they're cash strapped, they're bootstrapped, they're looking for ways to generate revenue, and all of a sudden you have all these requirements they have to go through. So how do you see startups getting impacted by these type of mandates? And do you think more and more startups will start adopting some of these mandates as well for vaccines or testing?
So I think that there are a couple of things to split this into. First of all, early stage companies, especially pre-seed and seed companies, even Series A, the maximum employees they have is anywhere from 20 to 30. And one of the things that I think is most important is to think about it in terms of the product and how and if the mandates can impact the product, and then your team. Because with early stage companies, your team is by and far the most essential part of your success. And if your team does not feel safe or comfortable or able to be candid about the challenges they're facing, whether it's on the health front or the pandemic front or their professional responsibilities, you're going to have bottlenecks. And in early stage companies, bottlenecks are the number one reason why a company isn't able to go from milestone to milestone and secure funding. So I want to talk more about team to start, which is what we have seen so beautifully articulated in the past year is that teams are able to work remotely, and they are able to accomplish tremendous things remotely in a way that 2 years ago, no one would have ever imagined was possible. So if early stage companies are concerned about the need to have everyone in one place, I encourage them to think through the biases that might be creating that impulse. There's a couple of things that open up when you open yourself up to remote teams. The first is you can hire from anywhere. So you may not be able to get the level of expertise at the the rate of income you're able to offer someone in your region. But if you open up your team, you may have new market insights because you're able to hire someone from 2,000 to 3,000 miles away. The other, and you may be able to do that at a where it keeps your labor costs down as you're trying to scale. The other thing is to create a clear plan of action for your team. Most early stage founders are so busy spinning plates. They're fundraising, they're trying to build their product, they're trying to market, they're tracking their analytics, they're building investor decks. Oftentimes, even though the team is the heart of whether or not these early stage companies are successful, the processes that allow people to feel confident and secure get lost in the shuffle. And so if an early stage company wants to respond to mandates, one of the number one things that they can do is sit down, take half an hour, write out what the priorities are for safety and helping your team feel like they can trust you and how you're going to approach this risk. And then sit down and have a conversation with everyone and say, if you're sick, this is what we do. If you have issues with testing, this is how we support you. If you are concerned about disclosing health issues, we've set aside a dedicated individual to protect your confidentiality. And so by planning ahead and setting some expectations about how you're going to approach mandates, but also when people get sick, because people will get sick, having that process in place allows people to focus on their work as opposed to how do I manage this very emotionally and intellectually charged situation that I'm not, I may not feel comfortable talking to other people about. So that's one thing. When it gets to product, this is where people really need, early stage companies really need to think about, what their value chain is, what their supply chain is, and what the implications of not having a mask or a vaccination mandate mean to them. So if they're in a region where there aren't masks or vaccination mandates widespread, all of their supply chain will be slowed down. It's not a question of if, it's a question of just it will happen. And so if they're in a region where they're relying on people who aren't necessarily trying to mitigate transmission, they need to plan for that in their business model, or perhaps choose a region that is being more proactive about transmission.
I feel as though Gena walked through my private practice.
Tell me more. And Mahesh, I'd love to hear from you too. It's all three of us. Mahesh, I'm curious, what do you think are some strategies that early stage companies can put in place?
So I run a private practice, and it is a business model as well, because it's a private practice. And our space is very limited in one of our locations, and our space is bigger in a different location. So we have students who want to come through the training process, nurse practitioner students or PA students. And we're very mindful about the space because of the pandemic. It's very important for us. We are closer to Boston. The location in Milton is closer to Boston. So it's high commodity value, space very limited. And we don't encourage any medical reps or anybody else coming because of the risk of transmission. And our patients also, we encourage them to do televisits if it's possible, or if that's what they want. We tell them, please, let's just do televisits if they're comfortable with it. Any patient who's doesn't sound like COVID, but they do want to come for an abdominal pain or a foot injury or things like that, and they have to be physically seen by the physician, then they do come into the clinic for us to examine them and do the needful. And secondly, you were talking about the procedures, right? We do something called a pulmonary function test that we've not done in the past 1.5 years. The machine is just kind of closed and kept aside because whenever the patient is breathing in and out, they can be transmitting the COVID, and it's a risk for the staff and for other patients. So we totally kind of closed that part for now till it's safe to open. So I was just thinking about what you said. I mean, about the risk of transmission and the procedural thing. So I'm thinking about my medical procedural, but I guess it's a similar path pattern that we follow. And thirdly, the employees feeling safe in the workplace. So before we do anything, we've been having regular meetings with them, with the staff. It's a small staff group, but we do have regular meetings with them, asking them if they feel it's okay to come to work, even during the pandemic. And they wanted to come to work. They feel they'll go insane if they sit at home and do the work from home. They're like, they want to come to work. And it was good because we have other rooms. So each staff had their own room. So they were not cross-contaminating. And they wiped down the places and everything else. And then before they go home at the close of business, they do all that. They take care of all those precautions. And if they get sick, what kind of strategy planning we do, that's another thing. First of all, we don't even want any one of us to get sick, because we take care of a lot of patient volume. And we know it's really important. And I tell them it's really important. You're taking care of so many people in need. So we have to stay healthy and stay careful and secure as well. And I do go and get repeatedly tested because I'm always exposed, being the physician, and even small things which they don't need to, like the vitals, the blood pressure recording and everything, if they don't have to come and touch the patient, once they room the patient, I take care of those things. I'm just trying to minimize the risk of exposure to different staff there. And I do go get tested periodically, so many times. Now the testing person knows me by name now. So those are a few of the methods. And yes, if somebody falls sick, what is the sick leave? How are we going to troubleshoot it? Where can I send them? So we already kind of have a plan. So it's not that we want that to happen. It's just that they feel comfortable, that they have a backup plan in case something happens. So those are a few of the things. That's why I said I felt Gena walk through my clinic.
And I think even on my side, running a startup, we're very much in that same category, not even more in that we actually work with COVID patients because we're working on COVID treatments, and so I think even without that particular risk, every startup should think through the risks of just business, of having one of your employees getting COVID, being out for 2 weeks, and hopefully recovering, or worst case, having lost that employee, versus then looking at getting a vaccine mandate and having all of them get vaccinated. And I think having spoken to a lot of startups, one of the concerns there is, if one person gets COVID, yes, they're gone for 2 weeks, but if I ask my entire staff to do, go get the vaccine, I might lose my staff for 2 or 3 days because they're recovering from the vaccine and they're not able to work. So it's like, well, if one's hypothetical, this I know is going to happen. Should I continue doing it? But I think it's important to understand that you don't have to have your entire staff vaccinated all at the same time. You can stagger that. Go through different weeks, right? And but also plan, as Dr. Muppana said, plan through what the contingency plans are, because some employees don't want to go get the vaccine. So how do you deal with those particular employees? And some don't want to work with anyone who's not vaccinated. How do you work with those employees, right? And so there are a lot of plans that they do have to strategize. So it's not just about employees being safe from your perspective, but they have to feel safe, as Dr. Muppana said. But also, you don't want to feel like you're infringing on anyone's right to do something. That being said, private companies are private companies. So if companies need to get the mandate, there's no law that says you cannot. Okay, so any employee that says it's against my constitutional rights, that protects you from the government, not from private companies, right? So it's always interesting to kind of play that balance. But yes, you certainly want to respect their wishes, but at the same time, you want to see what are the risks there for other employees. And so all you need is one employee who's not vaccinated to infect the entire office, right? It's a very simple thing. And kind of going to one of the points I wanted to talk to Dr. Muppana about is that we are currently in the Delta variant phase. We have other variants that are coming up, Theta, Zeta, like all these other ones that are slowly popping up their heads. But we already know that Delta has a contagious period up to 2 days before it even shows any symptoms. So it appears that there's really no way to try and mitigate or contain this virus as is. vaccinated or unvaccinated. I mean, it's just being spread even before we know we have the symptoms, which wasn't necessarily the case in alpha. Like we knew that we had that 72 period. So you see, if you have symptoms, you're spreading it at that point. We knew that. Now we don't have that surety. So, to try and mitigate this as much as possible by getting vaccination. So even if they get it, they're not out for 2 weeks, they're maybe out for 2-3 days. Or if they are for 2 weeks just for safety, how do you plan so that, are you going to pay for them to be off for 2 weeks? Are they taking vacation time? And not a lot of employees are going to be happy about taking vacation time for something they had, without any control of their own. But at the same time, you can't pay everyone paid time off for 2 weeks just because they got sick. That it's their responsibility not to get sick, right? So a lot of these things have to be thought through, and it's even more important in a small company that is bootstrapped, that is cash strapped, that has very few employees. So one person could be responsible for an entire team. He or she's not there, that team is stalled, right? Your development has stalled, your deployment has stalled. So there are a lot of factors that certainly affect smaller companies that have 10, 15, 20 individuals in the entire company, and having one or two of them out for 2 weeks might really sometimes even kill a company, right? And so it's very important to plan for these aspects. And we certainly have in our company. This is a discussion that's constantly ongoing between our board, between our C-level executives, as well as each of the team members. We make sure that we're having conversations with anyone that's in our lab, from an intern all the way up to our executives, and making sure that they're okay with where we are, but also any way to mitigate any concerns that they have. We certainly try to do that on a daily basis. So I set aside about an hour every day just to talk to people and make sure that they're okay, willing to come to work, because we don't have the luxury of doing remote work because we work in a lab, and so we can't just give each person a lab either. So they have to come to work. So some startups are in that situation where and certainly healthcare workers, like they can't work from home, right? They have to be there, and so there is more risk. And so like we have to pay for extra insurance in case people get sick. And so these are things that they have to think about. But if this conversation hasn't happened already, it's something that has to happen soon, I think, in every company, because we just don't know how long this might be. It could be there for another 2 years. It could be for the rest of our lives. And hopefully we'll find ways to get around it. But we'll have to plan it so that it doesn't get us by surprise. And, the economy has been recovering. We don't want anything, again, to stall the recovery, putting more jobs in jeopardy, putting more companies already in jeopardy. That's just from a startup experience perspective where we are looking at it from a company, and how we like to think through this process as well.
Mahesh, I had some thoughts when you were talking about just setting aside time. Oftentimes what I hear from early stage founders, CEOs, is I just don't have the bandwidth. And what we're dealing with right now is if early stage founders, if they do not set the bandwidth, the implications of not setting the bandwidth to plan and make sure that they are not losing a large group of their team, a large percentage of their team due to exposure, especially in high transmission rates. If they don't set aside the time to make this planning, the most likely outcome will be is that they will be stalled for longer than they wanted to be. And so, I'm always reminded of situations where people say, I don't have the bandwidth, when it is a very high risk, high priority issue. And what I try to share with them is they can try to plan now, or they can try to plan later. If they push the planning down the road, oftentimes the implications will be much more serious and will have a larger impact on their business. So how do I work with you as your mentor, or as your peer, or as someone who's consulting with you? How do I work with you to help you carve out that time to make this a priority? And if I think a lot of founders come back to this and say, maybe they've just raised a Series A and they've gone from 20 employees to 70 employees, and they don't have the infrastructure, they don't have the HR infrastructure in place to be able to roll out a proposal like this. there are other ways to do it. If you've just raised a Series A, you've probably got some cash on hand. So do yourself a favor and go hire a consultant who could write it up for you. And then task one person to put together that rolling plan of vaccinations, or task one person to be able to check in with everyone and let them know this is how we're moving forward. And we're doing this because if we don't, the implications could potentially run us into the ground, especially in areas with high transmission rates. So I think that one thing that I always try to remember with them is it's an elephant. You got to eat it one bite at a time. And if you don't have a plan now, it doesn't mean you won't have a plan 1 to 2 weeks from now. It's just about setting the time and the intention.
Absolutely agree. And just for the sake of time, I had a couple other questions for both of you, and I do want to end on a positive note. I don't want to be completely negative on where things are. Dr. Muppana, one of the questions I had for you is, apart from vaccines and treatments, where do you see some opportunities that companies can innovate and look at what's broken and make it better, so that we can get out of this particular pandemic and go back to at least somewhat of a normal life that we used to lead before this pandemic. So what are some inefficiencies you saw in the system as a clinician that maybe you thought hasn't been tackled yet or can be tackled better than what we're doing now? So obviously vaccines and treatments, they're there to help, and there's been a lot of innovation there, but where else have inefficiencies not been addressed yet that potentially one of the viewers, entrepreneurs might be able to tackle and fix those problems?
I think the first and the foremost is the vaccination, right? That's one thing. I think I want to take this opportunity to say that everybody should get vaccinated. I respect the individual decisions, but that's my recommendation. I think everybody should get vaccinated. The only contraindication for not getting vaccinated is if they had anaphylaxis, really life-death anaphylactic reaction or anaphylactic shock they had, and that will be the only contraindication for the vaccination. Otherwise, everybody should get vaccinated. It's not only for their own health, but for the benefit of the family members, and also benefit of the co-workers and their friends, whomever they mingle with, right? I think that's really important. And it's individual decision, but as I said, this is my recommendation, and that's the healthcare recommendation as well. So that kept aside, other than the vaccines and the treatment strategies, I think the most important thing is when you are going in a crowd and okay, the person traveled and came, or they went to a different place, a high-risk place, and came back, as a good Samaritan, I think it's important for you to say or avoid. So I was really, recently I was in a party, which was an outdoor party, and it was restricted number of people, and with the mask and everything being provided, but somebody who was sitting next to me had cough and sniffles. I did not know that. And so my question to them was, I think maybe this was not a great idea. It would have been better if you just avoided. And said, okay, they didn't have so many symptoms. What was said and done? After 3 days, I went and I said, I have to get myself tested. So I went and got tested, right? Because I'm in a high-risk situation, but not everybody needs to go and get tested periodically. And that's one thing. Testing when there's any level of suspicion, that's important. That kept aside, I think now the small businesses and startups, they became very, very creative during the pandemic, extremely creative during the pandemic. And I think they've stayed resilient. Majority of them did stay very resilient, and started thinking out of the box with remote work, and how to still stay connected with people, because it's not only affecting the families and the kids and the teenagers and the young kids who are not been able to go and see their grandparents. So the grandparents come and visit, and in one corner of the porch, and the kids and family, the parents are there in another corner of the porch, some kind of interaction to make ourselves feel more alive, because we're all social beings. And meeting in the parks, outdoor activities, all those, I think those are things that definitely will build relationships, better relationships, and some cohesiveness within the groups or within the startup companies, between the co-workers, because that's been missing a lot in the past 1.5 years. having small gatherings, that's what I would start off with, and outdoors if you can do it. If you can't do it outdoors, indoors, but with a little bit of maintaining distance, that's I think the human value and the human connection is the most important thing. That's one thing we need to definitely tap on. And the second thing is the gadgets. Even in the cars, when you come back, having the sanitizers there, little tools there, just for you, just to feel that, okay, you're taking care of the germs or using masks. And please don't use the mask repeatedly, the same mask every day. If you wear a mask one day, the blue mask or the surgical mask, I think those should be disposed and you need to wear a fresh one the next day. And the other thing about the mask, because I'm on it, I wanted to mention, please don't wear synthetic masks. No synthetic masks at all. People say, oh, so they wear fancy ones, which is good. You have to get, you want to have your vanity and you have to be, up to times. But the synthetic ones are something just like having a plastic bag on your face and you cannot breathe. That's not good for you. Okay, so you become more irritable because you're not able to get good oxygen and things like that. So the basic mask or the surgical mask, the blue mask, which everybody has, they're selling everywhere these days. And if not, just a good mask, which is a 3-ply mask. That's what I would recommend. Those are what were initially used, even when we're going into the patient's room, isolated patient's room with different diseases, that's the mask which we always wear, other than the N95s. The N95s for healthcare workers in high-risk situations. But in regular thing, I would not recommend any nylon masks at all or synthetic masks. So that's something to avoid. And I don't think that message was clear to everybody. So that's why I'm just reiterating on that. And hand washing, those things. And what are the inefficiencies I can think of? I think I'm just going to let Gena answer and then I'll come back to that.
Sure.
So we're talking
And-
about inefficiencies?
Yeah, just inefficiency in overall system, not just within healthcare, but overall system that companies can tackle.
So there's two things. First of all, it's pretty straightforward to rent or invest in one of the products where you can go through your building. It's like it's a large product that basically sprays disinfectant on everything instead of having to spray it all down by hand. That's exhausting. We've seen teachers have so much exhaustion from that. Like if you're a company and you can afford $150 or $200, go get something that's just going to spray the whole space. The other thing is with your temperature, if you're reading people's temperatures in the office, make sure that the device that you're using isn't something you have to touch and that it's set properly. I've seen people go through and not sanitize it, and there's like 20 people using the temperature checker, and then it's all coming out with the same number, and it's because they haven't set it properly. So just make sure everybody knows how to use the temperature reading device. It takes about 5 minutes to bring people up to speed, and it's one of those little things. Those two I think can be the most useful in the workplace.
Absolutely. I guess just for the sake of time, let's have one more question for both of you. But go ahead, Dr. Muppana.
So one thing is getting good rest and good sleep. I think that's really, really important. And I've seen a large increase in the number of mood disorders. A large increase in mood disorders, let it be insomnia, not able to fall asleep, stay asleep, or let it be anxiety, depression, loneliness, frustration, tiredness, getting fatigued for the whole process itself. And I think if anybody identifies their coworkers that that's not their norm and something seems to be different, they should definitely inform their supervisor. So the person might be feeling shy to get help, or maybe they don't even recognize it. They don't know that they need help. So if the coworkers are noticing something, I feel I would encourage them to just mention it to their supervisor so it can be looked into, or a conversation at least can be encouraged with the person. That's really, really important. There's been such a huge increase in mood disorders in the past 1.5 years. And people are feeling very lonely and they're feeling extremely fatigued. I think these two things should be definitely focused on. especially in small places, right? And it's good if it is a small startup companies, you kind of know each other, you know your you know their preferences to a certain extent, you would know. And so those need to be kept in mind, I feel. That's one thing. And getting good rest and getting good sleep.
Excellent. I guess the last thing I want to touch upon, Gena, is just an overall the startup space. Obviously, despite the health catastrophe and probably one of the worst economic downturns in modern history, startup businesses and the activity within startup businesses have grown dramatically in the last year. I think we, since 2019 and 2020, we actually saw like a 25%, increase in startup formation. What are some things that are driving this startup formation, and where do you think this could lead, at least from an economic perspective, but also from a startup perspective, where this could lead in the next year or two?
Sure. So a couple of things. Anytime there's an economic contraction, which is what we encountered, you'll see an uptick in mergers and acquisitions. And that's because when you have an economic contraction, companies that are right on the margin and are concerned about their ability to weather the economic contraction will often look for buyers. So how does that relate? When you have an increased M&A activity, and then you have an increase in something called, Janet Yellen call it quantitative easing. Basically, the Fed sets an interest rate that is so low that it allows companies to access credit at a very competitive rate. And so what you'll see is when you have a lot of access to credit, companies are able to build up their cash stores. And we've seen that with some of the larger companies out there in the US and abroad. And so they have a lot of access to capital. They need to find a place to invest it in. And it just so happens that a lot of the places they've chosen to invest it in are alternative strategies. And for us, alternative strategies is venture capital. So you're seeing more pre-seed and seed capital distributed across the economy, especially in the US. When you have an increase in available capital, and you have an increase in supportive industries. So we have a lot of new emerging industries that support startups. Accelerators are one of them, but there's dozens of different B2B models that are supportive of early stage companies. What you see is this whole ecosystem of infrastructure combined with lots of access to capital, lots of distribution of capital. And then you've got this third element, which is traditionally in an economic downturn, people who don't want to stay at their jobs or who have lost their jobs, they either try to start a new business or they try to go back to school. And this year, nobody could go back to school because all the schools were closed. So you see a lot of people funneling into launching businesses. One of the things that's unique about this particular economic contraction is there have been many people who have had a defining moment in their life where they've asked themselves, am I doing what I really want to do? And for many professionals and white collar workers, they've realized they're not going down the right path. And so we've seen an uptick in individuals from that sector launching businesses. So what's going to happen in the next year? I don't see M&A or credit availability slowing down anytime soon. I forecast that there will continue to be a large surplus of capital being distributed into venture capital funds through alternative investment strategies over the next 1 to 5 years. And so for companies that are looking to start an early stage coming out, unless you're doing a restaurant, or you're doing something where your team has to be very high touch, I think you have some interesting opportunities here that didn't exist maybe 5 years ago.
Okay.
I know
Dr.
we're
Muppana,
running
anything
short
to
of
add?
time. Can I just ask Gena one question?
Yes, please.
So Gena, and to you, Mahesh, as well, what do you see as the upcoming startup? In which field do you see any upcoming startups?
I mean, what I'd really like to see is more localized supply chain. Instead of going 10,000 miles away using a Kanban model, which is what we've used in the past. So Kanban basically says demand pulls the supply. You keep a very low supply in your manufacturing space. You're very, very careful about how much supply you have on hand. And it's the thesis is that everything is stable. And what we've realized and what we've seen in the economy is this bullwhip effect with supply chains. What we've realized is sometimes the best thing you can do is find a manufacturer with a supply chain that's within 100 miles of you. And I'd like to see more emerging companies in that space, how to optimize at the Kanban level, but at in a regional environment, instead of having to go 10,000 miles to get that manufacturing optimization, being able to do it locally.
And interesting enough, I have a pretty similar view, but more from the biological perspective. I think synthetic biology is really where the future of just everything is. I don't think it's just medicine. I think in terms of how food is going to be developed, how clothes are going to be developed, how electronics are going to be developed. I think all of it will fall towards synthetic biology. I think we can start, quote unquote, manufacturing food from bacteria. When we have a flood somewhere, okay, let's instead of growing a particular crop, we can grow algae there. They can make some other proteins for us. Or if you want neurological, let's say instead of silicon systems, we can go after biological synthetic systems where we can make chips out of neurons that we grow instead of using silicon chips. So I think that's where a lot of innovation I think is going to come in the next, let's say, 10 to 15 years. But the part of that is the manufacturing side of it. I think manufacturing is really where we're going to take that step forward. Manufacturing, just the basic needs or I guess the building blocks to make these things. So having quote unquote fake meat or synthetic protein instead of actually having to make get it from beef or pork. We could just grow the meat that we're looking at, the protein that we're looking at, or we can grow the silk rather than from actually using silkworms. We can actually get the building blocks to make silk, or even cotton and things like that. So I think that aspect of biological manufacturing and bringing that to all aspects of biology, not just where we are in terms of medicines. And at this point, part of what we're doing is manufacturing, looking at mRNA. We're making a protein inside a patient. That's all that is, and that is in essence manufacturing. So to be able to do something like that in the medicine side, we can really apply that to multiple other industries. And so I think that's where companies are coming up. I can't name just one or two. I think there's just too many at this point to just say this is one company to look forward to. But I think genetic engineering and synthetic biology, I think that is going to play a lot bigger role, not just in biological sciences, but all aspects of every industry. I think that's going to be the next big revolution, moving away from just industrial revolution to computer revolution. Synthetic biology revolution, I think, is where the next journey is going to take us in terms of innovation. Yeah. Excellent. So again, thank you both for joining me today. I think hopefully all of our companies, as well as investors and everyone else looking at this event today, has enjoyed this conversation. I think we hit many different topics, but I think we kind of kept it to what we want to talk about, which is COVID, startups, and innovation. But any last words before we let you go?
I had one thought too. Generally during crisis times, small luxuries tend to be very, very stable. So I wouldn't be surprised if we get a few beauty companies coming out of this. Oftentimes when everyone's stressed out, if they can go spend $5 on a nice tube of lipstick, they'll definitely do it. So we might see more companies coming out that are small luxuries.
I think that's really important. I mean, homemade items, small things, I think they do really well too. Yeah. But I wanted to take the opportunity to thank Mahesh and Gena. It was wonderful. I always learn something from all these webinar and the Zoom meetings. And thank you very much for introducing me to the small startup sector, even though I realize mine is also one such.
It goes both ways. Thank you so much
Yeah.
for the best practices. And I
Yeah.
know many founders who are watching this will take a step back and say, okay, what can I do that has been recommended today?
Right.
Right.
But I
And
do
we
want to say that
Sorry, go ahead.
I think we all have to take care of ourselves and empower our own health. So it's really, really important to just introduce some kind of good eating habits and also some exercise, anything, whatever keeps you happy and fun, you like doing, you enjoy doing. I think we should definitely incorporate that and be mindful about that. So that's my take. Thank you. Thank you very much. Look forward.
Excellent. Thank you both again, and thank you everyone that joined us today. Hope you enjoyed all the company presentations and all the other presentations that are coming up, as well as the fireside chats and other sessions that we have the entire week. And thank you again for our guests. Enjoy the rest of the day, and appreciate all of you joining us.